Welcome to the unveiling of Untold History documentaries, mastering classes in business management, and sparking insights through money dialogues. This is JephKafka TV, where you discover untold business histories, master the art of management, and ignite money conversations that matter.
Social health insurance. Okay, I must admit that as we are recording this, the whole concept of changing from the National Health Insurance Fund to the Social Health Insurance is still confusing, even to me. And with all this research that I've gathered here, I've also tried to contact the toll-free number that has been provided for the social health insurance.
That's it. M-O-U-M-A at finsprint.io.
It's Mouma at finsprint.io.
Yeah, so you need to send those documents.
And from your knowledge, have employers been able to register?
The employers are registering.
Okay.
Yeah, the only thing they're not able to do is upload the payroll.
Oh, so as at now, it's not possible to upload, but by then it will be possible.
Yeah, so what you do is do the registration and then you download the payroll template.
Okay.
Yeah, and then you fill in the details, you just remain with one part of uploading.
And I must admit that they too do not have adequate information that can be presented as maybe the final information about the social health insurance. But with that said, I've been able to gather as much information as I can to be able to differentiate between the NHIF and the SHI, and also to understand why the whole thing has come about. The World Health Organization, through what they call the universal health coverage, they have tried to make nations adopt the universal health coverage, whereby everyone, irrespective of their social status and class, should be able to access health and for free. So that is one of the reasons why we changed from the National Hospital Insurance Fund to now the Social Health Insurance, to include now the Millennium Development Goals by 2030, that every person should be covered by the health insurance. Now, in our discussion today, we shall look at what the terms mean, how to register for the social health insurance, and how it will affect you, in terms of going to the hospitals, in terms of paying, how much you'll be paying, how much you should be paying, how much benefit you'll be getting, and all that. So, karibu to the ride. Let's see what happens. Let me explain. Despite the controversy marred by the whole concept of the social health insurance, I want as much as possible to maintain a very objective mind, withhold myself from any political comments about scandals and all that, and try as much as possible to be patriotic and hope that this thing will work as it was meant to be. So first of all, I want us to understand the terms. First, that for the whole social health insurance to work, it must have first of all been passed by the parliament. It must have become a law first. And the law is in this. So this is the Social Health Insurance Act of 2023. So that is the law that establishes now what you're talking about. And it has replaced another act that we normally knew as the National Health. Initially, it was known as the National Hospital Insurance Fund, but no, it was the National Health Insurance Fund, or the NHIF. It was also an act of parliament that we've been working with, but now has been replaced, as at the recording of this video that is on 1st November 2024, it is no longer functional. The last month that it was functional was the month of October. Now, having said that the SHIA, that is now the Act, has replaced the NHIF, then they formed a body to oversee the whole process. Another body that was formed is the SHI, which we simply call the Social Health Insurance. So what basically it means is that what will be overseeing the whole concept of health insurance, health funding, people getting treated, hospitals getting paid by the insurance, is now the social health insurance. So already we have those three terms got out of our way. The National Health Insurance Act, that is the law that establishes the whole concept. The National Health Insurance Fund, that was the law that has now been replaced. And the Social Health Insurance, which is now the organization that runs the funds in the insurance. Now, the SHI comes again and has three funds that it runs under the Social Health Insurance. These funds are: one, the Primary Health Care Fund. The Primary Health Care Fund. And two, the Social Health Insurance Fund. So here's another term that has been used, but it's not the replacement of the NHIF. It's actually one of the funds that the SHI is managing. So the first one is the Primary Health Care Fund. The second one is the SHIF, or the Social Health Insurance Fund. And the third one is the Emergency, Chronic, and Critical Illnesses Fund. So let's get that straight. That the Social Health Insurance Act manages, or rather is the law that establishes the social health insurance. And the social health insurance, unlike the NHIF, which had only one fund known as the National Health Insurance Fund, now has three funds. One, Primary Health Care Fund. Two, Social Health Insurance Fund. And third, Emergency, Chronic, and Critical Illnesses Fund. So there are three funds being managed by the Social Health Insurance. Now, if we look at each, starting with the Primary Health Care Fund. The Primary Health Care Fund is supposed to be accessed or accessible by anyone and they give a very special specification at level 2 and 3 of hospitals in Kenya. So, first of all, these are not private hospitals. These are not private clinics. These are not the Aga Khans and the Nairobi hospitals, but the government hospitals at the local level. So, if we look here for a little bit, where we're talking about the hospital levels, we have hospitals at 6 levels. There's the community hospitals. Then there is the dispensaries and clinics at level 2. Then there are health centers or sub-district hospitals at level 3. Then there are district or primary hospitals, that is level 4. Then there is the provincial or secondary hospitals at level 5. And then there are the national or referral hospitals at level 6. So hospitals like Kenyatta National Hospital or Moi Teaching and Referral Hospital could be at level 6. And if you're in Nakuru, the medical hospital is at level 5. It's a provincial hospital. You know about the district hospitals. And then there are the health centers and dispensaries at the ward level. Now, going back to this, the regulations by the social health insurance have given a list of what can be treated at each level. So we're saying the primary health care fund will be able to treat first outpatient services at these two levels. That is level 2 and 3. So outpatient services, so you're going to consult about preventive and curative elements, outpatient services for diagnosis, normal medicine, for lab investigations, for radiological examinations. They give a whole list of items that you go to an outpatient service and you're treated. So outpatient services, ear health services, eye services, oral services, screening services, mental services, rehabilitative services, assistive services, maternity health services, inpatient services, and even last expense services. But on condition that it's at level 2 and level 3. Meaning that you can't just wake up one morning, you have a problem with your tooth or a problem with your ear, and go to a district or provincial hospital. You can't wake up one morning and go to a national hospital because of an ear infection. You have, first of all, to go to a primary health care fund center, which is level 2 and 3, which is the dispensaries and clinics, and get treated. It's only after they are unable to treat you at that level, or when the funds allocated for you at that level are exhausted, that they can now refer you to the next levels of treatment. That is the district, the provincial, and national hospitals. Meaning, the only time you can go now to a district or a provincial or a national referral hospital is after you've been to a primary health care center, that is level 2 and 3. They have referred you to a higher level of hospital, and that is when now you're able to access that. Then there is a second fund that the social health insurance works for, that is the Social Health Insurance Fund, or the SHIF. Now, the SHIF is mainly the same kind of diseases, so it's another fund other than the primary health care fund, but now it is specializing for levels 4 to 6. Meaning when you are at level 2 and 3, you're using the primary health care fund. Probably it's not clear, as I said at the beginning, those are funds that have been set aside by the government, that have been decentralized from the national government to county governments and then to the wards and all that. And according to the WHO, that is the World Health Organization, universal health care, everyone is supposed to be able to afford health care without having to get money out of his pocket at the moment of treatment. So meaning at the primary health care level, anyone should be able to access levels 2 and 3 of the hospitals, that is dispensaries and health centers, and get treated for absolutely free for those cases that you've talked about. The same case happens to now the second package, that is the Social Health Insurance Fund, or the SHIV. But now this is for levels 4 to 6, and the regulations specifically state that it is subject to referral from primary level facilities. That is the only time you go to these hospitals for treatment using the social health insurance is when you've been referred from the level 2 and level 3 health facilities. Again, they do the same kind of treatments, only at an advanced level. Normal outpatient, that is consultation, diagnosis, treatment for general and specialized cases, They do also inpatient health services where you are admitted and you need things like physiotherapy, occupational therapy, oxygen supply. They also do maternity services, labor delivery, delivery both ways, that is normal and cesarean section. They do all medical supplies and equipment for, any of those things that you might go to hospital for. And at that level, that is the Social Health Insurance Fund level, they offer now the surgical services. But they have to be accredited first to offer the surgical services that you're going to ask for. So there is predetermination whether you'll be accepted to that level 4, 5, or 6 hospital to be able to access that service. So minor and major surgical services, management of complications that may appear, any additional medical or surgical services required after the first operation, all that. They give all that kind of things. So that now will be under the Social Health Insurance Fund. And according now to the information that we have, the population is contributing or pooling the funds that will be used now for the social health insurance. And the population is contributing in 2 ways. If you come here for a little bit, we'll talk about registration for the social health insurance, where you register as an individual and where you register as an employer. When you register as an individual, you will either be unemployed, employed, or sponsored. And the reason why now the employers are registering is so that now they can make remittances on behalf of the employed. So going back to SHIF, for the Social Health Insurance Fund, for conditions that will be treated at hospitals from level 4 to 6, it means now it's the public that will be contributing the funds, the public that will be pulling the funds, the same way we did with NHIF. But now, 2 things emerge. One is that there is a general increase in the amounts that will be available. Remember, NHIF, the contributions were maximum of about 1,700, irrespective of the salary that you are earning. But under the Social Health Insurance Fund, contributions for employees and those who are self-employed, depending on the household, will be 2.75%, and they add the word uncapped. That means if your salary is 10,000, then the contribution will be 2.75% of the 10,000. If your salary is 10 million, it means your contribution will be 2.75% of the 10 million. And something else very important that they have put is that it's on your gross salary. Meaning, we should be able now to understand when they say gross, it means they are saying it's not your basic salary. Basic salary is the normal amount that the employer pays you. Gross salary is the total amount of money paid plus benefits accrued from the working organization. So that means we are yet to find out some things. Like, one, for people who have benefits, like they have cars, they have houses that have been provided for by the employer, etc., how will they be able to get the values of those benefits so that they can be able to compute the SHIF benefit? And second, will they incorporate it together with the tax return, because the tax return already collects information about basic and gross salaries? So that is something we are yet to find out. And when we find out, we'll be sure to bring it to your attention. And the other thing about this deduction is that there is no insurance relief. Previously, under NHIF, whatever you paid towards NHIF, there was a 15% relief from your taxes. That means if you pay 1,000 shillings to NHIF, 15% of the 1,000, that is 150, is reduced from your taxes. But in this case, peculiarly, there is no insurance relief, irrespective of the amount that you'll be paying to the Social Health Insurance Fund. So one thing is the increased amounts. Now, I'm trying to restrict myself from being subjective or speech that might look political, but previously, or in the last 1 week, there was reports of, just giving an example that is related to what this increased amount means. Kenya Power and Lighting made a profit of 30 billion shillings after having made losses in the previous years. And the reason why they made that profit was simply because of the increased tariffs for households and commercial enterprises. Meaning that they didn't do anything more efficiently, they didn't bring in more innovations, they didn't produce more power. It's just that people were now forced to get deeper into their pockets to pay for the same services that they were being offered earlier, but at a higher price. So could it be the same case here? That now we have increased the rates for the Social Health Insurance Fund. We've increased the amount that the government will be able to collect from the public, because now we're saying this will be pulling from public, but will it translate to better services? Unlike the case of KPLC, where they've made billions in profit, but it's because of increased tariffs. Will it translate to better services? Because already there is discussion amongst the public that they have restrictions for cases. Like if you go to the hospital with a certain issue, maybe eye issue, there is a capped amount up to which the Social Health Insurance Fund can cater for you. Beyond that, you either go out or to your pocket, or you're not treated. Meaning, someone who's maybe contributing, maybe his salary is 100,000, means they'll contribute 2,750 shillings towards the Social Health Insurance Fund. At the same time, someone who is earning 10,000, they'll contribute 300 shillings. But we know that because it's universal health care, the person who is earning the 100,000 is supposed to pool his money together with the person who is earning 10,000. But when it comes to receiving services, they're supposed to receive the same kind of services, irrespective of how much money they brought in. But now the question is it fair that the person who is contributing this amount then goes to the health center and is told that we have capped dental services up to 1,000 shillings? Remember, he has gone to the hospital because of one case that needs 1,000 shillings, but every month he or she contributes 2,750 shillings, and the cover cannot cover for his dental or for his optical case. So those are some of the cases that maybe still need to be straightened, still need to be discussed, so that now, as we move on, people can get it clearer. So, brief summary on the social health insurance fund, we've said there will be increased rates. And the second thing is that these will be for levels 4 to 6. For surgical cases, they have to be pre-approved. For normal cases, they have to be referred, meaning you have to come from level 2 or level 3 and get that kind of service. And then we go to the third one, Emergency, Chronic, and Critical Illnesses Fund. This one has two funds. One for chronic illnesses and two for emergencies. So it's a good thing that the classifications were made like that, that you don't go to the primary health care facility when you have an emergency or when you have a chronic illness. So they created another fund to be managed by the SHI, that is the Emergency, Chronic, and Critical Illnesses Fund, which, as we're saying, has two categories, one for chronic illnesses and the other one for emergencies. Again, these are to be available in accredited levels 4, 5, and 6 hospitals again. So what are some of these chronic illnesses? Again, they have given a guideline. It can be found on their website. And we're talking about longitudinal management of diabetes mellitus, including managing symptoms, management of diabetes complications, all those are chronic illnesses, management end-stage kidney disease, that is dialysis, but they give a concession that it's supposed to be 3 sessions of dialysis per week per patient for 1 year. The chronic illnesses can also cover for kidney transplant and cancer management, bipolar disorder, depression and anxiety disorders, management of convulsive seizures and epilepsy, acute management for alcohol use disorders and other substances, management of psychotic disorders, inpatient care for mental disorders, diagnosis and longitudinal management of COPD and asthma. And it gives criteria that it should be levels 4 to 6 accredited to offer the specific services. So when you are under the cover, that is, you have registered for the social health insurance and you suffer from any or one of these chronic illnesses that have been listed, there are many, including also sickle cell diseases, Down syndrome, cerebral palsy, palliative care, all that kind of coronary syndromes. If you're registered with SHI, that is the social health insurance, and you suffer from those chronic illnesses, so the first thing you should do is identify which of these levels 4, 5, and 6 health facilities have been pre-accredited to treat that specific condition that you have, whether it's dialysis, cancer, sickle cell, etc. And then the fund, as we said, has 2 parts. A was the chronic illnesses. B is for emergencies. And as we know, an emergency is, someone could be very well, then all of a sudden they have a heart attack, they have a stroke, they have an accident. So the emergencies listed here include cardiac and pulmonary arteries, a major trauma because of severe burns, head injuries, severe wounds, multiple fractures, shock states, unconsciousness, severe respiratory distress, seizures status epilepticus. I'm not a doctor, so I might not know what this means, but acute coronary syndrome, acute cardiovascular accidents, pregnancy complications, and even ambulance services. So those are emergencies. So again, what we said is not clear is whether they have caps for how much amount that they can treat you for having a chronic illness or having an emergency, and whether it will depend on how much you've spent on the other categories, that is on the social health insurance fund or the primary health care fund. So I know that is a bit technical, that might not be very simplified as you are looking at, but I've tried as much as possible to simplify it. I want us now to look at something else. Registration. How do you register as an individual, and how do you register as an employer for the social health insurance? So as an individual, you're required to register with the social health insurance. And as an employer, you're also required to register. So here I have tried to register. So you'll find the steps that I've tried to go through using the laptop. And one for the individual was successful. The only thing that is missing, or rather that has to be done, is to get verified at one of the local health centers to be able to get the biometrics done. And we've also tried to register for the employer, and we have gotten hiccups because it requires, one, that we upload some documents, that is the business registration and the KRA PIN. And many people around are complaining that it's not possible to get that. We tried to make a few calls. As much as it took long before it was responded to, we got some assistance, which has not come through as at the recording of this video. And it's also not possible, as at now, to get the template that is required to make the returns, especially for the salaried employees. For an individual who is not employed, so for individuals, you simply need to go to afyayangu.go.ke. You'll find the part where you, as an individual, you're supposed to register. And as you have illustrated, you can see that. If you are employed, then you still need to go through the same process, but then you have to choose your employer. So meaning the employer has to have been registered or have been contributing the NHIF contributions before, so that he can appear in that list. And then you simply put in the data and it's complete. For the employer, again, there are three categories. One for the special groups, two for new businesses, that is a business that has not been registered for NHIF before, and the other one is for businesses that already were registered for NHIF. So that one is the easiest, and it's the one that we are using, or we are trying to use right now. So you simply put in the business number for NHIF and the password, and then you fill in the data. But as you said, we've reached, or rather we've met this hiccup where we are unable to upload these documents, and we shall update this video, or we shall update you when that issue is sorted. And we shall also try and attach one, the template for the modified payroll, because now we're saying that the contributions to SHIF for employed people, it will go to 2.75%, and there's no insurance relief. So we'll see how it affects the net pay and all that. So if you're an accountant, you're a HR person, then you'll find that one attached in this video. And now when we also get the template for employer returns to SHIF, which is supposed to start at the 9th, which is supposed to be by the 9th of the month, we shall also attach it. But as at now, those are some of the limitations that we are facing, and we cannot be able to move until SHIF or SHA or SHI sorts it. Remember to subscribe, share, and request all the information that you may need by asking us the questions down below.
This is JephKafka TV.